Hi, I'm Simone MItchell, a physiotherapist in Holy Spirit Hospital. I'm talking today about the lymphedema course that was made available in India recently. This course is a 135-hour course, which consists of a home study program as well as hands-on work. So initially when I heard of this course, it seemed extremely intense. I didn't expect as a practitioner that I would have time. I've been working for a long time. I didn't know that if it was needed, if I could spare that much time for this course. And when I went through it, I realized that it is important. It does need that much time to clarify your concepts, which is not taught on a UG or a PG level, in fact. In hospitals, we don't even talk about it so much. It's, you would say, it's overlooked. And when I went through the course, it was amazing. The in-depth knowledge that you get, and it's all logical. It makes sense. It's not something made up. It's something that's scientific, and they give you reasoning for what you're going to do and planning on how you're going to do it. The course was informative. It gave us details of everything you need to know to be as a practitioner. And I myself, when I was in the home study program, I read through it, and I wasn't practicing at that time. I had seen a patient of RSD in the hospital, and she had been coming to us for 2 months. She had significant relief in a number of various other complaints. However, she complained of swelling and tightness, which we didn't really address as such. I tried some of the techniques I learned in the home study program, and within 1 week, she had dramatic relief. That sold me. That made me realize the importance of this course. I wouldn't have come to know about it. It was ILF that had brought the course to India. It's Indian Lymphedema Foundation had a workshop in Holy Spirit Hospital maybe some months before this course had come up, and I didn't pay attention. I didn't think it important. They spoke about it. They were referring to cancer. I don't treat cancer patients. I didn't think it would really affect me or I would need it. And at that moment when the course came up, I don't know what made me do it, but I joined, and it was a blessing. I've learned so much. It wouldn't have been possible. It wouldn't have come around if ILF hadn't brought it, because it seems that the course was, they had tried to bring the course before to India, and it hadn't happened. So nobody was interested. But it's a prevalent thing abroad. And in fact, abroad they talk more about the cancer aspect of it. However, being a tropical region, we have filariasis and trauma-induced lymphedema, which nobody looks upon here. The importance is dramatic and evident, and we have to get into it. I would say that all therapists, practitioners who deal with cancer patients or traumatic cases need to look into doing this course, because it teaches you things that you're not aware of before.